You are welcome to my channel. Thanks for visiting. Today is all about cluster headache. But if you haven't subscribed to my channel, please kindly remember to do that. I appreciate it. Cluster headache. Without further ado, let's get all the facts about this troublesome headache. It is a primary headache, meaning there is no systemic trouble, infection, or any disease whatsoever that is causing the headache. Remember, arthralgia is joint pain. Myalgia is muscle pain. In this case, it is a trigeminal autonomic nevralgia. There will be a prodromal phase that will last about 1 hour before the attack. It is more in males compared to females at ratio 4:1 respectively. Genetic history is a key factor here. I will talk about that more in a bit. Cluster bouts will occur at about 1 to 2 episodes daily and will continue like that for about a week and in some people for a month. Relief is possible, but unfortunately, there's no cure. What are the signs and symptoms? It is more in males than females. It will occur at one side of the head, so ipsilateral or unilateral. It is going to be sudden. And the affected individuals would describe this as a horrible headache or a severe headache, or they call it a horrible pain in the head. It's going to occur around the eye, that's otherwise known as periorbital, or it will be at the temple. Remember the temple? That is the region behind the eye before the ear. It's a junction for frontal, temporal, parietal, and sphenoid bones. The attack can last 30 minutes, and in some people can be as long as 3 hours. Still on signs and symptoms, like I've said, it's going to be around the eye, right? Or the temple. The affected eye will become red, that is redness of the eye, and the eyelid will be swollen. When the eyelid is swollen, there will be drooling of that very eyelid called ptosis. It could become teary from increased lacrimation. And when physical examination is done, the pupil will be smaller. The affected eye will become hypersensitive to light. Still on signs and symptoms, there will be stuffy nose or nasal congestion. There will be runny nose or rhinorrhea. The individual will be sweating profusely and could become restless or agitated. The pathophysiology. Here we'll be dealing with trigeminal-vascular system activation with trigeminal-cervical complex. Also trigeminal autonomic reflex with parasympathetic nerve fibers, and also involving posterior hypothalamus. What are the possible causes? Well, we don't really have exact cause of causes. That is, none is specifically known or pathognomonic, but we are sure of certain triggers. Like I've said earlier, genetics. Almost everything in medicine nowadays is traceable to a gene. This is not an exclusion. cluster headache is genetic. Why that? In a man with cluster headache, first degree relative will have the chance of 10 times probability of having cluster headache compared to the rest population. Being male is more chance of having cluster headache compared to females. It's no crime, right? Because migraine headache is commoner in females. But when it comes to cluster headache, more in men. Alcohol. Wow. Alcohol could trigger cluster headache. Smoking could trigger it, just as cocaine can do. Release of histamines or serotonin or nitrates in certain foods could also trigger cluster headache. Still on causes, like I said, I will still repeat it. We do not have any known cause or causes to be precise. No. But we are familiar with certain triggers. Jet lag or sleep deprivation or sudden alteration in your sleep pattern could trigger it. You are living in low altitude area but suddenly find yourself in high altitude level. That could trigger cluster headache. You are indulging in an intense exercise. That could trigger cluster headache. You have just changed your position from room temperature to a very hot environment, either because you've decided to take very hot shower or you are just exposed to excessive heat or bright light. All this could trigger cluster headache. How do you make the diagnosis? Pretty simple. Just take the history. Everything we've gone through as per signs and symptoms will suffice. But you can also do physical examination. Since it is affecting the head and neck region, you examine as is appropriate. So it is not out of place to have cranial nerve examination done. Then grab your devices, check the ear, check the eyes, and check if the patient is restless or agitated. It is normal in anyone with cluster headache because they are passing through a very horrible, painful condition. Mostly in men, like I've said, but note this. They will be between 20 and 30 years old. Will these reoccur? Absolutely. Why that? Because when we have an attack and the individual is assisted and he gets out of the attack, that's not a cure. And that is why it will reoccur. We will treat. Bouts of attacks will occur again and again. Do we have prodromal phase here? Yes, we do. And that will start in about 1 hour before the attack. And the individual will notice that the sleep pattern has been altered, not intentionally. It means cluster headache is about to occur. The mood could change. The individual could become tired of fatigue, yawning more than necessary, even having nausea or neck pain, and difficulty concentrating. All these will serve as prodromal signs before the full attack in about 1 hour. Can we treat? Absolutely. But can we cure? No, we can't. How do we treat? Oxygen. 100% oxygen at some authority will put 12 liters per minute. Others will put 12 to 15 liters per minute. just help the individual know, depending what is obtainable in your jurisdiction. 15 liters per minute, oxygen 100%. Deep breathing exercise, then triptans can peak, just as if we are dealing with migraine. But in migraine, we don't go for oxygen. In cluster, oxygen first if it's available. Then we give acetaminophen just to relieve the pain, right? Some we even go for non-steroidal anti-inflammatory drugs. Other interventions like cold or hot compression, depending on what's obtainable in your jurisdiction. Prevention, which they say is cheaper than cure. That is, if the situation is curable. In this case, no, cluster headache is not curable, but it's not killing. No. Avoid alcohol. Please don't do drugs. No cocaine. Avoid smoking. If you are smoking, let's work out how to quit. Verapamil can be used to prevent cluster headache, particularly in very serious, horrible conditions. But be pretty careful. Work with your doctor, pharmacist, clinical pharmacologist. Work with them, please, because it is dangerous. Verapamil can kill you. It's a calcium channel blocker. Sleep normally. Less stress, please. And with that, I've come to the end of this short presentation on cluster headache. I'm wishing every affected individual the way out and enjoy their lives more. Thanks for listening. Please remember to subscribe to my channel. Remember to share this presentation with your loved ones on all your platforms. I appreciate that.